Hello everyone, how are you today? Welcome back to my channel. This is Dr. Education. I am Dr. Paramjeet. I am a consultant physician, cardiologist in Yashoda Superspeciality Hospital, Nehru, Nagar, Ghaziabad, Delhi NCR. And this is my channel. Here I make simplified medical explanation videos and I teach you about health and healthcare topics, and there are a lot of videos already made on my channel and you can check them out, browse for your favorite topics, and I am sure you'll find some very authentic and very useful information about your healthcare concerns on my channels. And if you do, don't forget to subscribe and hit the bell icon, because that's how you'll receive the next upcoming video. And don't forget to share the videos. Today's topic is, what are the medical conditions, what are the situations where you have a higher risk of developing kidney stones? What are the medical conditions which lead to kidney stones? So last time we had seen what are kidney stones, what are the type of kidney stones. We had seen the 4 types of kidney stones: calcium, uric acid, cysteine, and struvite stones. We've seen what are the symptoms and signs of kidney stones, how they are treated, what problems they can cause. So today we are going to see what are the medical conditions which actually cause kidney stones. So let's start.
If you want to know about health and have health concerns, then subscribe to my channel and hit the bell icon. You'll be notified about all upcoming videos.
So guys, as we have seen, kidney stone or a urinary tract stone can develop because of a blockage in the urinary tract. That's one of the main reasons. Now, this blockage can be because of external pressure or a stricture or some kind of infection causing to a stricture. Then there can be kidney stone in cystic kidney diseases. These are disorders that can cause fluid filled sacs to form inside the kidneys, like polycystic kidney disease. So cystic kidney diseases also have a higher risk of stones. Then if you have gastrointestinal bowel inflammation problems, if there is a chronic or a long lasting inflammation of your bowels, of your GI tract, that can also increase your risk of kidney stones. Then obviously cystinuria, having high cystine in your urines, as we've seen. And then gastrointestinal surgeries, or a problem of digestive system, digestion problems, indigestions. Then people with having gouts, high uric acid in their blood. Very high uric acid can lead to gout. That gout is basically uric acid deposition on the small joints, which can lead to arthritis, painful swelling of the smaller joints, especially of the toes. The great toe is the most typical one. Then hypercalciuria, if there is very high calcium present in your urine, that is a condition. This condition actually runs in the families in which the urine contains usually a very high amount of calcium, and this is the most common condition found in people who form calcium stones. So calcium stones are one of the most common types of stones. Then there is oxalate stones, which are basically combining with calcium to form calcium oxalate stones. So hyperoxaluria, that means high oxalic acid, oxalate in the urine, where that can lead to calcium oxalate stones. Then hyperparathyroidism, a condition in which the parathyroid gland, these are 4 small glands present behind the thyroid, and these release a parathyroid hormone, which causes increase in the calcium in the blood. So if you have a dysfunction, that means higher amount of these hormones, that means your blood will have very high amount of calcium, and that can increase your risk. Sometimes there is hyperuricosity, hyperuricosuria. Then obesity can lead to a risk of kidney stones. Then obviously we have seen uric acid levels, if they are very high in the urine, that can also lead to uric acid stones, and that is called as hyperuricosuria. Then obviously we have seen in the last video that recurrent urinary tract infections, repeated infections in the urinary tract, kidneys or bladder, can lead to stones. Then renal tubular acidosis. This is a disease which occurs when the kidneys fail to remove the acid into the urine, which causes a person's blood to retain too much acid. So that is a renal tubular acidosis, which again is a risk factor for kidney stones. Then people who take certain medications, they are more likely to develop kidney stones, and these medications are diuretics. These are often called as water pills. These pills, they help you get rid of excess amount of body water from your body. They basically excrete more and more amount of water in the urine that can lead to dehydration and therefore increase your risk of kidney stones. The second thing is calcium. If you are taking very high amounts of calcium supplements without any need, if you are taking antacids which are based on calcium, that can increase your risks. Then there is a medication called Indirapuram. It is a protease inhibitor which is used to treat HIV infection. That can increase your risk. Then there are certain other anti-convulsion, anti-seizure medications, especially something called as topiramate. So these are a few medications which can increase your risk of developing kidney stones. So all these diseases are there which can lead to a problem in the kidney or in the urinary tract or in the function of urinary tract, either structurally or functionally. They can lead to a problem and increased deposition of all these types of minerals, causing stones and then lead to problems. So if you have a kidney stone or if you have a family history of kidney stone, then you need to get evaluated for all these conditions, and that would be done by a urologist, which will actually do a thorough physical examination, a complete medical history, and routine blood tests and checkups, and even sonography and imaging studies on you to check out what kind of risk factors you have, and then we will formulate a plan for you to actually tackle your risks as well as your problems of kidney stones. So that's all for today, guys. I hope you liked the video. Next time I'm going to talk about the diet in kidney stone, diet which is used to treat as well as prevent kidney stones. So hope you're liking the videos, and don't forget to subscribe and hit the bell icon. Don't forget to share the videos to your friends and family. I hope you're doing that for me. And till next time, stay connected, stay healthy.